Hello and welcome to this lecture. Today we are going to discuss antidiarrheal agents and the type of drug that are used in this classification are opioid agonists such as loperamide and diphenoxylate, whereas the other classification is bile salt binding agents, which consist of cholestyramine and cholestyramine, and these two agents are used uh, for the treatment of diarrhea. How they act? The opioid agonists work by increasing the colonic phasic segmenting activity. How they act through inhibition of presynaptic cholinergic nerves, and what happen actually what happened in diarrhea actually, and the segmentation movement or the movement of small intestine become weak. Like in this case, the movement become weak. Spaces are so many spaces, but weak regular spaces, and this is the example of regular spaces, and you can see this is a weak regular spaces, and due to weak regular spaces there is enough space for the material to pass. So that's why uh, a person have to go to toilet regularly, whereas in regular space they are peristaltic movement, we can say that, and the movement is just like in a regular phase, and the food cannot pass very quickly. It move with certain fixed ratio or fixed time. And I mentioned here that they increase the colonic phasic segmenting activity as I discussed, and then by inhibition of presynaptic cholinergic nerves. So they act on the submucosal plexus and mesenteric plexus, and because these muscles are responsible for the maintaining the segmenting activity. So the inhibition of these presynaptic cholinergic nerves help to maintain the segmenting activity. So the question is that why I need to go to the washroom right after eat, and they explain in terms of the concept which is known as gastrocolic reflex, and it is a reflex that stimulates the contraction of colon, and that leads to need to go to washroom. So it means when you eat the food and when the food enter into the stomach, it initiate the contraction in the colon, and then the colon start contracting and get rid of the food that is already available before maybe you eat 1 hour before, and then it go out. So it is known as gastrocolic reflux. Let's discuss some of the drugs that has been available, and the drug we have is Imodium, which is known as loperamide. The dose for the adult is around 4 to 8 milligram daily in divided dose, and the dose may be adjusted depending upon the severity, with the maintenance dose of maximum 16 milligram daily. Then we have diphenoxylate, which is also used for acute diarrhea and chronic diarrhea. The dose for acute diarrhea is 10 milligram as an initial dose, followed by 5 milligram every 6 hours for adult. Whereas for chronic diarrhea, the initial dose is 10 milligram, followed by 5 milligram after every 6 hours. The dose for acute diarrhea and chronic diarrhea is same, with the initial dose of 10 milligram followed by 5 milligram after every 6 hours. Let's discuss the case presentation with a 35 years old man with a 13-year history of abusing opioids and had undergone detoxification for 4 times during this period. He underwent detoxification by using 200 milligram of loperamide, which is quite big amount, as the recommended dose for loperamide is 16 milligram. The maximum is 16 milligram. But in this case, the patient is using 200 milligram loperamide, it means he is misusing the dose and drug with anticholinergic agents, cholinidine, and non-steroidal analgesics, and diazepam. And after reading this case, we have some discussion. Number one is that loperamide is known to be decrease the bowel movement, and it is used for the treatment of diarrhea, especially symptomatic diarrhea. And in any case, I already mentioned that 16 milligram, more than 16 milligram is not allowed. So below 16 milligram must be there, but unfortunately, in this case, the patient is taking more than 200 milligram. And under normal circumstances, if diarrhea persists, 4 to 8 milligram of loperamide prescribed for maximum 10 days. So these all points are under normal circumstances, which is used for the treatment of diarrhea. The dose must not be exceed to 16 milligram. And if the diarrhea persists, then the dose around 4 to 8 milligram for 10 days of maximum can be given. More than that cannot be given. If this continues, problem has not been solved, then we need to see the alternative treatment. And I mentioned that patient that uses 200 milligram, usually they use for lifting his mood, for elevation of mood, and this is a drug misuse. The researchers also found that if a person is having drug abuse with some heroin or codeine or morphine, then some of the researchers support the evidence of using loperamide to control the withdrawal symptoms, because it is also used for lifting the mood. But obviously the use of narcotics such as codeine, heroin, or morphine are not good, and if patient need to recover or rehab from these drugs, then we can give loperamide under these circumstances to control the withdrawal symptoms of the other drugs. Next question is that whether we need to use loperamide or difenoxylate, or both belong to opioid agonist, and both are under same classification. So we found that a study on the comparison between loperamide and difenoxylate in the treatment of chronic diarrhea. This is a double-blind crossover study, and then they found that loperamide was compared with difenoxylate, double-blind study on 23 patients with chronic diarrhea of various etiologies, and they found that both are capable of controlling or reducing chronic diarrhea, but loperamide was superior to difenoxylate in terms of decreasing the frequency and improving the consistency of the stool around 2.5-fold lower dose level. So both are effective, difenoxylate and loperamide, but loperamide can be beneficial more in low doses. So that's the result they found and they published in Gastroenterology. The next drug under this classification is bile salt binding resin, which is also used for the treatment of diarrhea. And the malabsorption of bile salt is also responsible for causing the diarrhea, especially chronic secretory diarrhea. The drug that has been used for the treatment of salt binding resin is cholestyramine and polystapol, and which they are both responsible for binding of the bile salt. And we already mentioned that the malabsorption of the bile salt or excess production of the bile salt is responsible for colonic secretory diarrhea. So these drugs are responsible for binding the bile salt and helpful in the treatment against diarrhea caused by these secretions. The adverse effect that has been reported is bloating, flatulence, constipation, and fecal impaction. So what is the mechanism in this? The main thing is that the conjugated bile salt is usually absorbed in the terminal ileum, in that section. So what happened that the bile salt binding resins such as cholestyramine or polystapol decrease the diarrhea by causing by binding with these bile acid, What is bile acid malabsorption? It is the condition where your intestine cannot absorb the bile acid properly and from time to time. And when bile acid are not absorbed properly, it leads to too much of bile acid, and that can lead to diarrhea and watery stool. And where the bile salt malabsorption occur, the site is usually at the terminal ileum. The drug we are using for the treatment of uh, this kind of diarrhea is cholestyramine, and the dose for the treatment is initially with 4 gram daily, by 4 gram at weekly interval to 12 to 24 gram daily in 1 to 4 divided dose, and then adjusted dose as required. The maximum dose that can be given is 36 gram daily. The dose for cholestyramine for bile acid induced diarrhea is initially with 4 gram, and then the dose can be increased 4 gram further at the interval of 12 to 24 gram daily in 1 to 4 divided dose, but cannot exceed the dose more than 36 gram daily. The other drug that has been used in the treatment is cholestyramine. Then next is octreotide, which is a synthetic octapeptide with action similar to somatostatin. And actually, somatostatin is the natural hormone that having half-life of 3 minutes only, and that is the function that have responsible for producing a number of functions in the gut, pancreas, brain, pituitary, thyroid, adrenal glands, and testis. But the problem is that this natural producing hormone have only half-life of 3 minutes. So they prepared the drug octreotide that having more half-life, 1.5 hours, for the treatment of diarrhea, and they are used for the inhibition of endocrine tumor effects, and it is used for the other causes of diarrhea such as vagotomy or dumping syndrome, or other uses such as pancreatic fistula. But they are having some adverse effects such as steatorrhea, fat soluble vitamin deficiencies, production of gallstones, hyperglycemia, or mild hypoglycemia. The drug that is available in the market is octreotide acetate under the commercial name sandostatin, and the dose that is recommended is 100 microgram 3 times a day. Usually, this drug is used for diarrhea that is associated with HIV, and the dose initially is 100 microgram 3 times a day. If the symptoms are not controlled after 1 week, then dose can be increased up to 250 microgram 3 times a day. If there is no effectiveness, then we need to stop the therapy. So this drug is not commonly used for the treatment of diarrhea. This drug is only linked to HIV-induced diarrhea. Actually, the drug this has been used for other purposes such as secretory neoplasms, for prophylactic conditions in complication with pre-pancreatic surgeries. Thank you so much for today's lecture. Hope to see you again.